Dr. Yesh Navalgund is one of the country's most respected authorities on interventional pain management. The founder and owner of a large independent pain practice in Pittsburgh, Pennsylvania. He serves as president of the Pennsylvania Pain Society and as a faculty member at the Rockefeller Neuroscience Institute. We recently spoke with him about the effectiveness of telehealth.
That is an interesting concern, and it's something I see very frequently. But what I tell my patients is very simple. We're actually enhancing the quality of your overall care. When you're involved in large institutions, large universities that have multifactorial management of pain, which is well established as the best way to treat pain, you have access to behavioral health specialists, you have access to nutritionalists, you have access to counselors. But unfortunately, in the real world, when we're out in rural America, what we suffer from is the inability to access these types of therapies. With remote access, we have a substantial advantage. We can bring all of those therapies, counselors, and additional treatment protocols directly to the patient in their own home. And I think overall, we achieve equal, if not better, management of their pain through remote access. The behavioral health clinicians can assist tremendously with things that I may not have time to address, particularly the social aspects of the patient's lives. For instance, I've had patients that have come to me with spouses that have passed away between our two visits. The management of their pain becomes substantially more complicated when a situation like that arises. But knowing that that may well have been addressed with a behavioral health clinician really helps me continue to manage their pain and focus more on the bio component of it and not as much on the social and psych component. So it becomes a decisive advantage for me as the pain management clinician to be able to hand off the responsibility of the social and psych component of their pain to a behavioral health clinician who's monitoring this on a regular basis. In addition, it gives me the option to afford the patients an opportunity to look at alternatives to opiates, particularly using the psych and social behavioral changes as a method to control their pain rather than the use of opiates.
Harvard MedTech, the visionary solution to pain.